Welcome to the deep dive. Today we're jumping into a really common and often debated finding in root canals, overfilling.
Hmm.
Where the sealer and gutta percha, the stuff used to seal the root, kind of squeezes out past the very tip.
Exactly. And the goal is always a perfect seal inside the tooth.
Right. So when it extrudes, well, it raises a big question for you, the clinician, and for the patient too. Is that little sealer puff a good sign, like a really thorough seal?
Or is it just, a slip up, an accident during the procedure that might actually cause problems down the line?
That's what we want to unpack today.
Yeah, our mission is to figure out, well, how often does this actually happen? Are certain teeth more likely to have this? And what does it really mean for the patient, especially with newer materials and techniques?
Okay, let's start there. Prevalence.
Hmm.
How common are we talking if you look at the research, the journals?
Oh, it's pretty common, more than you might think. Some reviews put the number around 32.3% of completed root canals showing some visible extrusion.
32%. Wow. So nearly a third of cases.
Yeah, it's definitely something clinicians see regularly, not exactly a rare event.
And does it happen everywhere equally, or are there hot spots in the mouth?
Anatomy plays a huge role here. There was a Turkish study using CBCT, that's the high-res 3D imaging.
Right.
They looked at over 2,000 single-rooted teeth. Overall extrusion was about, say, 11%, but it was much higher in the maxillary anterior teeth.
The upper front teeth.
Exactly, up around 13.17% there. And lowest in maxillary second premolars, only about 5%.
Okay. Why the difference?
Well, the thinking is those front teeth often have wider, straighter canals. They're also easier to get to.
Thanks for your access, yeah.
So maybe sometimes clinicians might subconsciously apply a bit more force during filling, push things a bit harder and pop, out it goes.
Okay, so this leads right into the controversy, doesn't it? If it's happening that often, is it a sign of, well, maybe technique not being quite right?
That's the million-dollar question. It's really divided. Some dentists argue, look, if you've cleaned and shaped that canal perfectly, a tiny puff of sealer, especially a modern one, might be totally fine.
Okay.
And there are studies, particularly with materials like bioceramic sealers, showing really high success rates, like 95.8%, even when there is some extrusion.
Why do they work so well even when outside the root?
It's fascinating, actually. Bioceramics are highly alkaline. They actively encourage the body to form a sort of mineralized barrier around the extruded bit.
So the body kind of walls it off naturally.
Pretty much. It essentially neutralizes the biological risk from the material itself.
But that's not true for all materials, right? Older sealers. Or maybe just the material itself acting as a foreign body. That can cause problems.
Oh, absolutely. Before any sealer fully sets, it has some level of cytotoxicity. It can irritate the surrounding tissues.
Leading to?
Inflammation, definitely. Persistent pain after the treatment. And in really unlucky cases, if a lot of material goes near a major nerve, like the mandibular nerve.
Down on the lower jaw.
Right. You can end up with paresthesia, that numbness or tingling sensation, which is obviously not something anyone wants.
And I read that some of the newer filling techniques, not just materials, might actually increase this risk.
Yes, particularly thermoplastic techniques. Think systems like Guttacore or Calmus, where they use heat and pressure to inject the gutta percha.
Okay.
A randomized clinical trial found overfilling happened in, get this, over half the cases, 53.33% with those systems.
53%, that's huge.
It is. And the issue is likely the pressure generated. It's just harder to control right at the apex. And crucially, that study linked this overfilling directly to mild or moderate pain after the procedure.
And was it worse in those front teeth again?
It was. With those techniques, the anterior teeth were 4 times more likely to be overfilled compared to premolars or molars.
Wow. Okay, so pulling this all together for the clinician, for the patient, what are the big takeaways? How do we avoid this?
It really comes down to prevention through meticulous technique. First step, getting the working length absolutely right.
Measuring the canal accurately.
Yes, using your electronic apex locator and confirming with radiographs, no shortcuts there. Then maintaining what we call apical patency.
Keeping the very tip open.
Exactly, with small files. But being careful not to aggressively widen that exit point. It's a delicate balance.
So precision comes first, and then material choice plays a role as a sort of safety net.
Precisely. You absolutely want to avoid sealers known to be problematic if extruded things containing formaldehyde, for example. The primary goal has to be keeping the fill contained within the root.
But if it does happen,
then the evidence strongly suggests that using highly biocompatible sealers, like those bioceramics we mentioned, significantly improves the chances of a good outcome. They're just much more forgiving.
Okay, so we've kind of established that overfilling, while maybe not an automatic failure, is often an avoidable accident tied to technique, anatomy, and maybe the filling system used. Respecting that apical constriction is key.
Absolutely. Which leads to a really interesting thought for you, the listener, to consider.
Yeah.
If we reach a point where these new generations of root canal materials are so biocompatible that they truly eliminate any biological risk when they extrude,
Huh.
does overfilling stop being a clinical problem? Does it just become a technical artifact you see on an X-ray rather than something that actually threatens healing or patient comfort? Something to think about.